Hello everyone and welcome to Know Your Drug, powered by MediInsights, the ultimate destination for all things of health and wellness from the fascinating world of medicals and pharmaceuticals. We are here to guide you on morphine tablets, exploring the various aspects of morphine, their usage, dosage, mechanism of action, side effects, and most importantly, essential advice for taking them safely and responsibly. Before we begin, let me emphasize that the content provided in this channel is purely educational. Always consult a healthcare professional for personalized advice regarding medications. Now, let's get started. Use of morphine tablets. Morphine tablets are primarily used to manage severe pain that cannot be controlled by other pain relievers. They are commonly prescribed for conditions such as cancer-related pain, post-surgical pain, and chronic pain from other serious illnesses. Morphine works by altering the way the brain and nervous system respond to pain, providing significant relief. Next, dosage of morphine tablets. The dosage of morphine tablets varies depending on the severity of the pain, the patient's prior opioid use, and individual response. Typically, the initial dose for opioid-naive patients may start at 15 to 30 milligrams every 4 hours as needed. For sustained-release tablets, dosages may start at 15 milligrams every 12 hours. Dosage adjustments should be made gradually, based on the patient's pain relief and tolerance. Next, mechanism of action of morphine tablets. Morphine exerts its effects by binding to opioid receptors in the central nervous system, specifically the mu-opioid receptors. This binding inhibits the release of neurotransmitters involved in pain transmission and modulates the perception of pain. By activating these receptors, morphine also produces a euphoric effect, which contributes to its potential for abuse and dependence. Next, side effects of morphine tablets. Common side effects include drowsiness, dizziness, constipation, nausea, and vomiting. More severe side effects can include respiratory depression, hypotension, and risk of addiction. Chronic use may lead to tolerance and physical dependence. Sudden discontinuation after prolonged use can result in withdrawal symptoms such as restlessness, sweating, and irritability. Next, important advice for using morphine tablets. Patients should take morphine exactly as prescribed by their doctor, without altering the dose or frequency. It is crucial to avoid alcohol and other medications that depress the central nervous system while taking morphine, as this can significantly increase the risk of respiratory depression. Patients and caregivers should be aware of the signs of abuse, addiction, and potential side effects. Morphine tablets should be stored securely in a locked container to prevent misuse, especially accidental exposure by children or pets. When stopping morphine after long-term use, it's important to taper off the medication gradually under a doctor's supervision to avoid withdrawal symptoms. Morphine use during pregnancy or breastfeeding should only be considered if the potential benefits outweigh the risks to the fetus or infant. Consult with a doctor before using morphine in these situations. By the end of this video, you'll have a solid understanding of the use, dosage, mechanism of action, side effects, and important advice for using morphine tablets. Remember, knowledge is power, and being well informed empowers you to make the best decisions for your health.